Ladies and gentlemen, hi, good afternoon to you. Thank you very much for joining us and welcome to our first lunchtime webinar of 2026 brought to you by IXPL, where we help you level up your health. My name is James and it's good to see you again. Ladies and gentlemen, we have an exciting lineup for you today, especially if you're interested in ENT, ear, nose, throat. We're so lucky to have professionals in today, physician, doctors, to share with us more. And of course, practical insights on how you can stay healthy today while protecting your tomorrow. Now, you also gain a better understanding of common sinus and eye symptoms and learn when to seek medical advice early and can truly make a difference with us today. So ladies and gentlemen, now let me give you a rundown on who's coming here today. Now, first and foremost, we have for you Dr. David Chin, ENT from Parkway East Hospital. And then, following which, we're going to bring you physician Lim Zhi Cao, PhD, senior TCM physician from Yu Yen San TCM Clinic. And finally, Dr. Jimmy Lin, ophthalmologist from Glen Eagles Hospital. Now, for those of you who have submitted your questions earlier on, please continue to submit them. We'll read your questions at the end of today's event. Now, ladies and gentlemen, firstly, it's my pleasure to bring in the first speaker of the day, Dr. David Chin. So, ladies and gentlemen, at this moment in time, we'd like to bring you, now the first topic, sinus. Now, everyone has it, right? Most of my friends have it, I have it. So what can we do about it? Today we have for you Dr. David Chin to help you understand the common nasal and sinus conditions. And Dr. Chin will also share when to seek medical care and the treatment options available. Now, first and foremost, this man here, Dr. David Chin, is an ENT head and neck surgeon with a subspecialty focus in rhinology, endoscopic sinus surgery, and endoscopic scalp-based surgery. Now, he did his post-specialist training with the Sydney Clinical Rhinology Fellowship, and subsequently, he served as a consultant at Changi General Hospital, where he initiated and headed the rhinology service from 2014 to 2016. We're going to learn so much from him. Ladies and gentlemen, Dr. David Chin.
Thank you very much, James, for that kind introduction. So I'm very happy to have everyone listening today because I'm very passionate about this topic of sinus. Every one of us probably has experienced someone, either yourself or your family member, who has a sinus problem, and I'd like to get into that. And even I have a sinus problem. So I've experienced pretty much most of the symptoms that you might be wondering about. So I just sell Koyo a little bit. I come from a clinic. I don't work alone. We have 6 ENT doctors, and I'm one of the specialists who deals with nose and sinus issues. So if you're wondering, how often do we have sinus? I want to define that. For most of us, sinus actually is allergic rhinitis. Some of us know that we might be allergic to dust mites, for example. And it is estimated, based on official records, that in the 1990s, it was at least 10% of the population had it. In 2000s, it was 13%. I think more recent data suggests that it could be about 20 to 25% of people who have allergic rhinitis symptoms. So I'd like to just bring us up to speed what sinus or allergic rhinitis is, because a lot of patients come to see us and they may have an upper respiratory infection, they may actually have sinusitis, they may have some other reasons for having these symptoms. But when you have a nasal obstruction gradually building up, when you wake up in the morning, you get a runny nose, and it's clear, cloudy mucus, you get sneezing, itching, sometimes an itchy eye as well. And this happens every single day. You sort of get used to it. You most likely have allergic rhinitis. And the difference between this and an upper respiratory infection is typically when people get sick, and most of us, all of us have had viral infection. You tend to feel down, you've got aches, it lasts the whole day, you've got a sore throat. That's very, very different from the usual pattern for people who have allergic rhinitis. And most of us will know, patients that come to see us will most often have already taken antihistamines off the shelf. They mentioned Zyrtec, Telfast, Claritine. These things are all familiar to you. And they work, and they often say, but I take it, I get better, and when I stop, the symptoms come back. And so they come to us thinking that they have a sinus problem. Today, I want to just touch on the fact that actually, if we understand an allergy as not like an infection, it's going to be there all the time unless you're using something to suppress that. So you don't get cured that easily. Now, for instance, if you have high blood pressure and you don't take your medications, then you're going to have the high blood pressure. So you're sort of dependent on that. But there are ways to treat this more effectively. So our guidelines say that if you're getting your allergy symptoms more than 3 days a week, almost every day, which is quite common in our part of the world because we don't have seasons, right? then you're much better off using a nasal steroid spray. Now, when I mention the word steroid, some people will get a little bit anxious. I'll come to that later. No, it's better to actually be on a regular medication that controls your symptoms rather than wait for it to come. Symptoms come and you keep chasing those symptoms. However, for allergies, actually, there are opportunities to have a cure. And I think for patients who have a long trajectory, if you're a child and you've got allergy at age 6 or 7, and if you're going to control your allergy for the next 30 years with nasal steroid sprays, then we should have a better option to treating that. I will come to that as well. There are options in treating with immunotherapy. So I mentioned just now steroids. So one of the mainstays of allergy treatment is actually using nasal steroid sprays. And people will invariably ask us, but steroids not safe to be used long term, right? Well, the truth is, the amount of dose that comes in the spray is so small that a minuscule amount of that gets absorbed into the system. Now, I'm just showing you these example graphs that, if you're giving a typical dose of 55 micrograms, if you can understand what a microgram is, in patients 2 hours after dosing, the amount that have less than 10 picograms, that's like 1,000,000 times less, I think, than the amount that you spray, is about 90%. So it's a really small amount. And the other thing that we all know about steroids is that if you take that as a tablet, if you get that, we call that systemic because it's going through your system. So when you take a tablet of steroids, it's going through to where you want it as much as it's going to your big toe, for example. So if we look at patients who take steroids for long term, for example, to suppress rheumatoid arthritis or lupus or chronic inflammatory diseases like that, then of course there will be an upset of that balance in the body system. But when we use the nasal steroid spray, actually there is no change. And I just showed this graph on the right side that shows 6 weeks after using it on a regular basis, there is absolutely no change in our body's own steroid levels because that minute amount doesn't really affect that axis of control. The other thing that people have is that they've used steroids for dermatitis and they say, okay, maybe the skin gets a bit thinner, and that does not happen in the lining of the nose or the sinuses because the anatomy is completely different. So that doesn't exist. It's one of the 2 myths that I need to clarify for most patients coming to see us. So it is safe. I mean, bottom line, it is safe. And in Singapore, most of the nasal steroids are approved based on the FDA American guidelines from age 2 years old and onwards. And the reality is that most patients that are less than 4 don't really need to use nasal steroids. Allergy usually starts about age 4 or 5 at the earliest. So how do we diagnose beyond the symptoms? If you want to know, you can do an allergy test. It can be a blood test. It can be a skin prick test. This is the most common way we diagnose. And in this picture here, you can see the various allergy tests being done on the skin, and we wait 15 to 20 minutes and measure. So you can see the one at the top right corner, it's really, really angry and swollen. So that's probably one of the allergens that this patient is allergic to. And in Singapore, actually, if you just throw a coin, actually, it's maybe 80% of patients you can guess will be allergic to dust mites. The thing is that we have a tropical season. We don't have seasons, spring and all that. So our biggest culprit here are dust mites. Occasionally, we get patients who have other allergies as well, but by far it is dust mites. So the thing about dust mites is that the 80% of patients that you pick just randomly will be allergic to dust mites. The interesting thing is that if you are negative to dust mites on allergy test, then you're very unlikely to be allergic to other allergens as well. These are the allergens that we commonly test for. So we don't actually, some patients look at these pictures and they're actually very, very worried about it, but we're only using a protein that comes from these allergy sources to test. And it's a pretty painless way to test. It's just it's not a true needle. It doesn't draw any blood. The most that people experience if they are allergics, they get a very itchy spot, just like a mosquito bite. So I mentioned earlier that this is one of the conditions where we actually have an opportunity to cure. And this is just, to my patients, I explain this. They say, is my immune system weak? No, it's not weak. It's actually overreacting to something that is actually harmless to us, these dust mites, for example. So can we train our body to not overreact? Yes, there's a way, and it's called immunotherapy. In some parts of the world, historically, it was delivered by injections into the skin, but that's a very tedious process. And for nasal allergies, we can actually use what we call sublingual immunotherapy, where we spray it under the tongue. And if we do that for a period of 2 to 3 years, then we then have a chance of changing the way our body's response to the allergen. And over time, the body then recognizes this as something that's not dangerous and it doesn't have to mount the full response. So when we move from medications, which I mentioned earlier, you could use antihistamines if you only get sneezing once or twice a week, nasal steroid sprays on a regular basis if you're getting more chronic symptoms, and if you're going for a cure, especially for kids and younger patients, then maybe immunotherapy. But then sometimes we do need to have surgery, and the main reason is that one of the symptoms of allergy is a nasal obstruction. So we can get a blocked nose largely because this structure in the nose, if you look inside your nose, you flare your nostrils, and you look hard enough, you'll see these two lumps at the side. Some people think they're polyps, but they're not. What you see, it's the inferior turbinate. It's called a turbinate. This tissue actually swells up when it's inflamed, just like when we get a flu. And if you have chronic allergy for many years, it gets bigger and bigger, just like you go to a gym and the muscle gets bigger. So you have to do something to unblock the nose. And we can do various different techniques to make that structure small again so that you can breathe freely. So an example of this, one of the types of turbinate operations that I prefer to do is actually to remove not just the excess tissue that has grown over the years, but actually remove the bone that underlies this structure because it gives a more lasting result. So you can see at 3 weeks, almost everything is healed back. Patient breathes much better. And the reason why I prefer this option to other options, for example, it's because if the patient then feels good and does not continue taking the medications, it is highly likely that the allergy will continue. In a few years' time, the lining could become swollen again. So by doing something that is at the same time aggressive in removing excess tissue but still retaining some of the lining of the nose, we can allow patients to have even if they don't continue using medications when they're supposed to, they still have a clear nose for the long term. Now, there are other symptoms. Some patients may then say, but I also have a runny nose, and I've done surgery, and I can breathe better. What am I going to do with my runny nose? I still don't want to be on antihistamines forever. I don't want to be spraying my nose. For these patients then, thankfully, about 7-8 years ago, some clever doctors, scientists in the US came up with a cryo device where you can actually freeze the nerves that stimulate runny nose, and you can disable them, and they can be disabled in the sense that it doesn't trigger a runny nose effectively for 1 to 2 years. So then you may ask, but that's 1 to 2 years. That's for many patients preferable to taking a tablet every single day. If you look at the results here in the initial studies, you can see quickly that within a month, the symptoms of runny nose, itchiness, and irritability of the nose goes down, and it can be sustained for at least a year. There's some studies that go up to 3 years that show still some prolonged effectiveness for some patients. So the bottom line is allergy of the nose, while it can be cured for most patients, if they don't undertake immunotherapy, then they're going to have to control it, just like you control your high blood pressure, just like you control your diabetes. And sometimes there is a need for surgery if your nose is very blocked and medicines don't help. But ongoing treatment then helps to reduce recurrence of symptoms. It also prevents those structures from swelling up and potentially blocking your nose again. And I want to go into what sinus really is, because patients that come to us and mention sinus, by and large, they have allergic rhinitis. But all of us have experienced what a true sinusitis is that you get your viral infection and it spreads into the sinuses. So what are sinuses? I'll show you a picture later on, but essentially the symptoms in words are almost the same. It's a nasal obstruction, sinus congestion, if you will. Then there's a nasal discharge as well, but the difference here is that, and people notice this, it's going to turn green, yellow, sometimes yellowish brown, and that they know, intuitively they know that this means there is a bacterial infection. It's not entirely true, but along those lines. And sometimes you get a pain as well. Sometimes if you've got very bad sinus infection, it can be painful. And we very often when we have a blocked nose from infections, we find that we can't smell as well. And that's not very typical of allergies. So what are the sinuses? They're actually air spaces within the head. The purpose, they're there for resonance, for our voice, to make our head lighter, we don't actually know. But imagine this, you walk through your nose, which is like the entrance cave, and then at the side you have these little holes that lead into big rooms. And when everything is going perfectly well, the big rooms are 99.9% filled with air, and the lining is thin, and everything is working smoothly. It produces mucus, and the mucus transmits out into the nose to our throat, and we don't feel anything. So I put a picture here, an example of a maxillary sinus, where the lining is absolutely quiet, no infection going on. We can't actually see this in a patient unless they've had an operation before. So I picked one where this patient has had an operation before, and this is when it's quiet, there's no infection going on. Now, if you had a viral infection and it doesn't get better quickly enough, the lining swells up in the nose, more mucus is produced, the lining in the sinuses then get swollen too, and then because the mucus is not moving fast enough, you get the opportunity for bacteria to grow. That's what we find in stagnant water as well. And over time, the mucus then changes and you get the discoloration. And here you can see this trail moving down from the exit point of the sinuses to the throat. And there are certain criteria for when we define when someone has got a bacterial sinusitis. And some of them are when you're initially getting better and then you get worse, high fever, pain, and those sorts of things. And patients that come to see us as ENTs will always say, okay, I've had this number of causes for antibiotics and I'm not better. Or obviously, naturally, because they've seen their GPs and they've been treated. So yes, if you look at all studies, if you give antibiotics for sinusitis, you get a better outcome. You get better faster. But on the other hand, some patients are actually more wary these days. They're wondering, how can I be taking antibiotics every time I get flu that I suspect becomes a bacterial sinusitis? Can you get better without antibiotics? And actually the answer is yes. So we have this antibiotic conundrum, right? To give or not to give. Some patients are also aware that you can easily get side effects. Some people don't get side effects, so good for them. But if you look into the fine print, every single medication that we take has got a side effect. And some of the more powerful antibiotics that we use, if you look in the fine print, you'll see that there's a risk of, for example, a tendon rupture in 1 in 700. And this could be quite serious, right? If you're taking antibiotic just because your phlegm has turned yellow. And the other question is, do you give it for 3 days, 5 days, 7 days? Who knows? Because there is an average number for a typical person, but it doesn't work for everyone. There are other factors that determine whether your sinus infection gets better or not. And this is no surprise. If you look at the charts for adverse or side effects from taking antibiotics, naturally it always favors not taking antibiotics. If you don't take antibiotics, you can't get side effects. The other thing that we think about if we're not just thinking about ourselves, we think globally, the more antibiotics we give, the more resistant the bacteria becomes, and we keep having to have stronger and stronger antibiotics. I will come back to this now, that these nasal steroids are not purely for allergies. They are also recommended treatment for sinusitis as well, because they reduce the inflammatory response that causes a lot of our symptoms. So the other thing that I'd like people to understand is that mucus from our sinus and nose doesn't move by gravity. It's not like you're going to, unless you have a lot of it, you don't tilt your head down and the thing's going to just drop out of your nose. It doesn't work like that. It is more like a conveyor belt, like a travelator that you have at Changi Airport. And if everything's working properly, the people move smoothly along, no one notices anything. The moment you have a choke point somewhere, everything backs up, and then it becomes a vicious cycle, right? You know this in traffic jams. Sometimes you're driving, the other side of the road has an accident, your side is fine, and then you realize that you're backed up for 1 kilometer behind, because these things are cumulative. And every sinus has got this flow coming through a tiny, tiny hole for exit point. So you can see in these examples here where the thick mucus is not moving out well. And one of the prime examples that we have as sinus surgeons is that in the past, sometimes with that lower picture on the right, you can see 2 holes there. They're literally 3 millimeters apart. There's a big hole, and we think with a big hole, any amount of pus is going to come out. But we have a phenomenon where patients get prolonged sinusitis because the mucus is coming out through the original hole in front on the left side of that screen, and then it's dropping back into the big hole at the back, so it's going round and round. So you get 90% of the stuff cleared, but some of it still goes on. And so why does this happen? Now, this coronavirus is not the COVID-19 that we talked about. This article was written in 2001, even before SARS. But you can see in even the first few days of any viral infection, that nice carpet of what we call cilia, which are these fine hairs on the surface of the cell that moves mucus along, gets destroyed. And so it's just like a war. The longer you go into a war, the roads get destroyed, bridges get destroyed, And even if you decide like a ceasefire, like what's happening in Iran now, you're not going to build back those bridges in one day, right? That's not going to happen. So how does this manifest? I think this is really important. A lot of patients come to us saying, oh, I've got better from most things, but I'm still coughing. It's been 1-2 months since I had this infection. No more pain. I don't see any mucus. Nothing's coming out. So there are various ways this mucociliary dysfunction can manifest, right? So you can get a prolonged dry cough after upper respiratory infection, sinusitis. Even sometimes with people with allergies, if their mucus is very sticky and there's been a lot of chronic damage of this mucociliary transport system, they can get these symptoms as well. So how do the patients describe it? Sometimes it's just sticky. Sometimes it's a feeling that something's at the back of the throat. I can't clear it. Sometimes the patients keep clearing their throat, or kids may be snorting. Or sometimes it may be as subtle as voice breaks. Now, if you take a lot of coffee, sometimes you may experience this as your daily thing. You're speaking halfway, your voice gets lost, and you clear your throat a bit and it clears up. So all these things reflect some form of mucociliary dysfunction. And you will get from your GPs and doctors various kinds of medicines that make mucus less sticky, to put it simply. But some of them do a bit more than that. They actually help the mucus transport to recover. Otherwise, when you have a bigger problem that's been there longer, you might use something, and this is something I highly recommend you try properly. It's not easy to do, but if you start to use a nasal saline irrigation. Now, some patients think, how could I possibly do that? That's what I first thought at first. I was telling patients about this theoretically until I started using it myself, and then I loved it. Essentially what you're doing, you're not trying to take a spray gun to move things along. You're actually irrigating it, and you know that if you have think about a river. If the river always has smooth flow of water, it looks clean, right? So, and this is what we try to help when we're trying to help mucociliary transport when it is not working well. When you're well, you don't have to do it. When you're recovering from sinusitis or in the midst of a sinusitis, you want to do it. The thing is that why does it not always work? It's because I mentioned earlier that the openings to the sinuses are very small, about 1-2 millimeters when things are normal. So can you imagine when it's swollen to be even smaller? So whatever we wash and spray on our nose never ever gets into the sinus unless you've had a sinus operation before, like the picture that I showed earlier. But it still helps because it removes the clog in the small junctional point. So at least if that junction is not clogged up, then there's a chance for something to come out. If the junction is clogged up, there's no chance at all. I just want to briefly mention another type of sinusitis, which is an entirely different disease now we understand after research in the last 20, 30 years. So you look at the mucus on the left picture where it's just this thick pus kind of stuff. And on the right side, it looks more like engine oil or honey or something like that. And it's super sticky, right? That's different. We recognize that as manifested in nasal polyps, which are basically super swollen lining of the sinuses and the nose. And the whole clinical picture is different. And we can see if we look at the cells. Now, in the past, we just described it as sinusitis, chronic sinusitis with polyps. But now if we look at the cells, we look further, we can see that the cell types are different. There's a certain type of cell called an eosinophil that defines a lot of the processes that happen. I don't want to go into too much in detail, but over time, they've looked at the kind of chemical messengers that are involved in that sort of inflammation, and it's entirely different as well. We call this type 2 inflammation. So briefly, if you have chronic sinusitis, what this means is that our definition is that you've had it for 3 months or more. It doesn't mean it has to be exactly 3 months, it could be 10 weeks, whatever it is. The whole reason for the sinusitis persisting is no longer just blocked, no longer just a type of bacteria, but the whole dysfunction of the lining of the sinuses. And look at the yellow box here. The guidelines from the most respected body in the world says that in this situation, you use saline washes, you use intranasal steroid sprays, that's what INCA is. You avoid antibiotics. And so patients would think intuitively, oh, if I got infection, I should be taking antibiotics. But clearly, the guidelines based on a lot of evidence from studies says avoid antibiotics, right? But then steroids work in this condition. I can show you this chart. When you see that diamond far to the left, it shows that it reduces symptoms when you use steroid sprays. And if you use it for longer, it helps. I mean, oral steroids, right? They definitely work. Patients know it works better, except that they know that there are very, very severe long-term complications and side effects, and even short-term side effects there are. So you can't keep using oral steroids even though they work. And it's counterintuitive for you know that steroids actually suppress the immune system. So this is not a question about the immune system being weak, but it's a question of the immune system not being regulated properly. You've got an army that you're just throwing around and shooting everybody in the way, right? So that's what's happening. So don't use antibiotics. Try to use sprays. We call this topical steroids because it's not going through the system, the rest of your body. And we find, in studies show that if you wash it, it's more effective than drops, which are more effective than sprays. The sprays that I mentioned earlier on are actually designed for allergy of the nose. So they just reach the lining of the nose. They get nowhere close to the sinuses. That still helps. And the key, again, is because the opening is very small. So if you do have sinus surgery and you open that hole from the 1 millimeter to 5 to 10, you obviously get the 50, 100 times more effectiveness. So I have to mention sinus surgery because at some stage, some patients will need this. We call it FES because unlike other operations where we just cut things out, we put the term there functional because we want to say that we try to maintain as much of the lining as we can because without the lining, the sinus will never function. So if you look at this video here, we're looking at the patient's right side. I hope this doesn't alarm anyone. But this is a very complete sinus surgery where we've joined up the 3 main sinuses into one big cavity. This is now looking underneath the maxillary sinus under the eye. It is smooth, it is clear. And the reason why we need to do it for patients like this is because in nasal polyps, if you leave any little corners there, it allows the polyps to start growing again. It allows mucus to build up, and you can't control it with the washers that you want to use. So this is a patient who has had what we call a full house sinus operation, where it's totally open on both sides. We have heard in the past, and sometimes still, this very sexy thing of balloon sinuplasty, very, very minimally invasive. I have used it on occasion, but I think that if you have the ability to do a very wide sinus surgery with no additional risk, like the picture I showed earlier, that is preferable. Because with a balloon, you get the maximum size of maybe 4 millimeters going through all of that. I think the only role for it is for perhaps patients who have a reason why they can't have a full operation. There are some patients who are on antiplatelets for the heart, for example, or if the only one sinus is affected and we need to do that. So a balloon basically just opens up that particular sinus. And some patients, they can even have operation where you open it so wide. Now you can see this patient. This is the left side. That is the center. Behind that's the brain. And those are the structures that we need to be careful about when we operate. But you do it with care. Everything works out fine. You can wash this nose. This nose can work with gravity alone, at least this part of the nose. And we have to get our patients to wash our nose. Now, this is mainly for patients with polyps because they need to do this as an ongoing treatment for a long time. But it's techniques that even people who get the acute sinusitis like you and me from time to time can use it for 2 or 3 weeks. Now, just to say, what was the point of learning all about the inflammatory markers, what messengers there were in the cells? Well, for some patients with nasal polyps, no matter what we did, we couldn't control it. And a lot of patients know this, I got polyps, it's never going to get cured. But thankfully, with the advance of science and research, in the last 15 years and in sinus, you've got these things called biologics. So they're basically antibodies that are specifically targeted for messengers in this pathway. And if you can block the messenger, you can block a lot of that. So we have various ones. I won't go into the fine detail of what they're blocking, but I want to show you this chart that people have worked out the whole pathways, and they can make blockers to block what's happening. And it has been shown in studies that you can improve symptom scores, you can make polyps stay away. I mean, if you stop using the medication, you can see that over time it will recur. But that's far better than having to go through 5, 10 surgeries in some cases, or having a nose that's always blocked with thick mucus and you can't smell. So I was very happy with this gentleman. I can show it because it came up in the newspaper. He was the first patient that, as far as I know, had these biologics used to try to control his nasal polyps after having the most extensive surgery that we could dream of. And I went through him with the first generation ones. It worked, but wasn't that great. And second generation one has been a life changer for this gentleman, where he used to have to take steroids every few months. And so he's quite a small bone guy, so we don't want him to be at further risk of osteoporosis and all that. So now I've got to go into something else. If you don't have a sinus problem, the other thing that's becoming an epidemic in Singapore is snoring and sleep apnea. And everyone's talking about it more and more. Our physician colleagues, cardiologists are sending patients to us because we now recognize that a lot of the side effects of sleep apnea relate to the cardiovascular system. So what's this? Obstructive sleep apnea. So basically, it's a period of time when you're asleep, of course, where the air flow is diminished or you don't get any airflow at all. It's blocked. Airway is blocked. And the reason that happens is because when you're sleeping, you're lying down, there's no muscle tone, everything just falls back and flops away. So you may then have this kind of situation. You can see in this animation that you've got breathing, and then suddenly they go flatline there. It's basically no air is going on, but the effort to breathe increases and increases. The person is struggling as his oxygen drops. You can see the lowest chart there, that's the oxygen dropping. And then at some stage, there'll be such a strong trigger to wake and the sleep gets disrupted. And they go through this cycle tens, hundreds of times a night, depending on how severe it is. I just want to be brief about this. It is very important. Every one of us, I am sure, either has a chance of getting it or has a family member who has it. Every home definitely has got one person affected by this. And in an early case, it may just be snoring upsets the wife. It's noisy. But no, if you leave it there for 10 years, you end up getting hypertension. You leave it there for 20 years, you end up having a higher chance of getting heart disease. If you leave it there for 30 years, you have a higher chance of getting strokes, vascular dementia, the whole list of things. And the earliest sign for some of us is that this thing about our blood pressure. So, our normal blood pressure is supposed to be 120/80. That's what the textbook says. So a lot of people think about, 120 is the number to look at, and 140, they're worried. But sometimes you may want to pay attention to the lower number. What if it's sitting at 85? Is that normal? If you're sitting at 85 and you just got up in the morning, that is not normal. That's a sign that your body's under stress at night already. The cardiovascular system is working harder. There are various explanations for that. I won't go into that. But that's something to look out for. But if you really want to quantify this, we have a thing called a polysomnography, which is a big word for a sleep study where we measure breathing, oxygen, the heart rate, what stage of sleep a person is going to, oxygen, that sort of thing. And you can put a whole graph together like we were kind of showing you in the animation early on. Some people now are going for portable studies where you just wear a little ring or something on your hand and you can get a pretty accurate diagnosis. And especially because if you had to have everyone going to have the full study, with the number of patients that we suspect might be affected by this, there could be long delays in getting your test done. So you can ask further about this. Now, why am I talking about this? Sleep apnea is a whole subject in itself, and I can't talk about it. But because I'm focused on the nose, I will want to emphasize that when we sleep, there is only one correct way of breathing, and that's through your nose. And so why is that? I mean, when we go and exercise, right now, I open my mouth, I get a quick breath in, and I'm much better off. The difference is that when you're asleep, the muscles are all fully relaxed, especially when you're in REM sleep. Rapid eye movement is when you're dreaming. Your whole body is essentially paralyzed except for the eyes. And so what happens then? Your throat then collapses down because you're lying down. The tongue drops backward. And we can see this in a very, very old study here. Look, on the left side of the graph, the two charts when you're awake. Whether you use your nose or the mouth, there's hardly any difference in the upper airway resistance. But when you are asleep, looking at the nasal breathing versus the oral breathing, you can see that when you breathe through the mouth, even though the mouth is much bigger, you then get a higher resistance. It's really harder to breathe with the mouth open, and it's not natural. It's not the way we should. Obviously, when you're lying on your back, which is what most of us prefer, things get worse because the tongue falls more easily backwards. Now then, it's not just a matter of treating it when you're an adult and you've got high blood pressure. Now you've got to think about your next generation as well. Our jaw is basically growing when our teeth are growing, somewhere between age 5 and 14 roughly. And if you do not breathe through the nose, then it's not going to function very well, and the jaw bones don't grow properly as well. That means not enough space for the teeth. And so that there's another meaning to that saying, if you don't use it, you will lose it. And then you end up getting a whole feature of a certain thing we call an adenoid face, and the teeth are all crooked. And even if this person goes on to have braces, remove teeth, later on teeth look perfectly straight, they still have a small jaw, so they're going to go into adult life with a small jaw. And if they can remain at BMI 17 forever, maybe they'll be fine. But if they can't, at some stage, they're going to get sleep apnea, or they're going to be a higher risk. And even more thing, we compare, the studies have shown that oriental faces like mine, compared to a Caucasian face, is a higher risk. You've got a flatter face. So I come back to this picture again, just to show you the turbinate that I started with when we talked about allergy. A normal turbinate on the left side, you can see a pathway right to the back of the nose. If you've had allergy for a long time, your turbinate has gone to the gym for 5 years, it's going to look big like this, like the biceps, right? And no matter what you spray into this nose, it's not going to get smaller. But there are sometimes other reasons. A lot of people are aware of the nasal septum and that can be deviated. And sometimes the cartilage is bent right from the start of the nose and the gateway is closed. In children, this is important from around age 4 years old until about 10. They have a structure called, we all have this, but in us, in adults, it's smaller. It's an adenoid. It's the same tissue as the tonsils. It's essentially lymphoid tissue, and it can get big, and it can block the nose. So in children, this could be a problem. And it makes it very easy to resolve in children as well. If you take the adenoids out, if that's the only reason, the snoring is resolved. So just running through the principles of management of obstructive sleep apnea here. So we want to consider all the factors that might be contributing. Think about things that are correctable. For example, if the patient's got early rhinitis and you can spray the nose into breathing clearly again, that's something you can do. You can correct it. It's always good to be on the slimmer side and losing weight. And that's part of the problem with people increasing in age. Apart from muscle tone getting lax, the unwanted tissue is also getting bigger, even around the throat and in the neck. In the same way, just quickly, like you can go to the gym to build up your muscle tone, you can do the same thing for the muscles of the throat, the mouth, and the tongue, and it's called myofunctional therapy. Otherwise, if you skipped all that, most people will realize, oh, if I've got sleep apnea, I'm going to be putting myself on this machine, right? That's called CPAP or BiPAP, positive airway pressure. Essentially, the machine blows air at a certain pressure, so it prevents the collapsible tissues of the throat from closing up. And then if we have to do surgery, we have to optimize the nose by clearing the big turbinates, adenoids, maybe tonsils. That all relates to that nasal airway that goes from the nose behind the soft palate and down into the voice box. And then there are other kinds of more increasingly aggressive surgical options that can be done. So CPAP therapy, I sort of mentioned this. You put a mask on or a pillow, and it blows air at a certain pressure, and it prevents that floppy part of your soft palate or tongue from dropping back. For some patients, mild to moderate sleep apnea, sometimes you can actually get these customized oral devices, mandibular advancement devices. You fit them in, it just fits perfectly if you get a custom-made one, and it pulls the tongue forward and pulls the jaw forward, and that could be sometimes preferable to having the machine, a whole contraption. So I'll go back to the nose now. So even if and it's true again, just like nasal polyps, you cannot easily cure obstructive sleep apnea because there are so many factors, right? The person could have big tonsils, that's easy, or he could be BMI 35 and have a blocked nose. So what do you do? If we know that they still need to be on CPAP, and I said the best way and the only way to breathe correctly when you're sleeping is through the nose, then we should not be using a full face mask like the picture on the left, but should be using something that really just works on the nose, a nasal mask, or even more comfortable, a nasal pillow. So you can see the picture on the left, the guy's eyes are staring because he's not comfortable. Look at the guy on the right, he's smiling there, he's ready to go, right? So okay, just want to give you some idea of what the inside of the nose is in the cross-section. So we talked about the green part is the airway that you need to breathe. If a turbinate is big, take care of that. If a septum is deviated, there is no medical treatment for that. If it needs to be straightened out, then you need surgery. So then what do we do? So this is a side image of this wall, the septum that divides the left nose from the right nose. So in the front, you've got the cartilage. That's why your nose is not stiff. And further back, you get various bones. So when we do the simplest operation for a deviated septum, which is called a septoplasty, we basically want to keep the top and the bottom part of the nose as what we call the L strut. So that's like the pillars and beams of a room. And if you keep that in between, the rest of it doesn't have to be there. So in the diagram on the right side that cut out, essentially that part can be removed and you don't really affect the strength of the nose. Of course, unless if you're doing contact sports, that's a different thing. But just for a normal sedentary person, the nose is not going to fall because of that. And you can actually, this is a patient, a typical patient, a slight septal deviation, a fairly big turbinate on the right side. And if you do surgery, you can make it straighter. You can make the turbinate smaller and look very, very nice. And you can tell this is probably about 3 weeks after surgery because there are still a few red spots still healing away. This patient breathes 100% better, right? And this is what it's like. So this is a septoplasty, can be done from inside the nose. But sometimes we actually have to do a rhinoplasty or a nose job, not for cosmetic reasons primarily, but because the part that's affected is the front, it's the cartilage. And the cartilage is not something where you can just cut away. I've talked about that. We need the structural support. So in order to get to that part of the nose, we often have to make incisions, as the picture on the left shows how it's drawn. Typically, we don't draw a straight line because it becomes too obvious then. And I apologize if you're having lunch and looking at this picture. Sorry, just had to explain this in real life, right? So you can see a patient that is deviated, and sometimes we need to correct the cartilage. And this is what a scar might look like 3 weeks later. And you can see as well, sometimes without planning to do it, you can actually make the person look better as well, because a nose that is deviated is often collapsed. And you can see the picture from left to right, how we have not just straightened the nose, but actually the side profile and probably the front profile looks better as well. So key points today, we started with sinus because the sinus, or what we describe as sinus, often leads to all these other problems, whether it's allergy, sinusitis. The treatment options are pretty much the same. And if you're thinking long-term, obstructive sleep apnea is the next big thing that is going to affect us. And we've got to start thinking from when the patient's a child, because if we do it right, we set them up for success later in life. Okay, thank you very much for your attention today. If you want to ask questions or you want to scan the QR code, you can.
Thank you so much. Thank you very much. Ladies and gentlemen, that was Dr. David Chen. Wow, we learned so much from this man. Now, Dr. David Chen, otorhinolaryngologist from Parkway East Hospital. Great session. Now we truly understand what sinus issues really are like. Ladies and gentlemen, now next up, firstly, if you have any questions, please do submit them for Dr. David Chen in the chat, and we'll get to them in the Q&A session later on. Now, next up, ladies and gentlemen, we're still in the topic of ENT, and we had perspectives from the West. Now we're going to get some perspectives from the East. I would like to bring you physician Lim Zhi Chao, Senior TCM Physician, Yu Yan San TCM Clinic. Now, we're honored to have Physician Lim. He's a bilingual TCM practitioner registered with the TCM Practitioners Board of Singapore with over 13 years of clinical experience. Now, he holds a PhD in Chinese medicine with a focus on oncology, a master's in Chinese medicine focused on rheumatology, as well as dual degrees in biomedical sciences and Chinese medicine. Ladies and gentlemen, we're fortunate to have such professionals joining us. So if you can join me, well, let's welcome physician Lim Zhi Chao.
Hi, thank you. I'm physician Lim from Yu Yan San. So my sharing today is on managing sinus and allergies with the help of TCM. Okay, so a brief introduction about myself. So I'm a full-time TCM physician with Yu Yan San, currently stationed at Woodleigh, Mount Elizabeth Novena, and Guaco Tower. So this is the outline of my sharing today. TCM, how TCM views sinus and allergy, a few acupressure points that you can do at your own free time to help better manage sinus, some herbal remedies that you can incorporate into your lifestyle, and some dietary and lifestyle adjustments. So, sinus is getting more and more common in Singapore today. So before I go into how TCM views sinus, let me just share a few symptoms that you can see before you. So do you wake up with blocked nose? Do you sneeze non-stop when weather changes? Do you experience pressure at your sinus when the aircon gets too cold? Do you experience runny nose in the morning? So these symptoms are very common in the clinical setting nowadays, and usually they reflect an underlying sensitivity in the respiratory system. So, from the TCM perspective, why is this so common in Singapore nowadays? Firstly, air conditioning. Singapore is a very hot country, so you can basically find aircon everywhere. And prolonged exposure to cold air actually weakens our lung system, making it more susceptible to cold pathogens. Next, humidity. So Singapore is a very humid environment, and this humidity actually contributes to the dampness in our body, causing phlegm and congestion with the sinus. Dust and pollution. So dust and pollutions are external irritants, and in TCM, we coin them as external pathogens. And when the lungs T, or the immune defenses of the lungs, is weak, it makes us more susceptible to these external pathogens. Lastly, stress and poor sleep. So being under prolonged stress and having poor quality sleep, so all these will weaken our body, weaken our body's ability to self-regulate. So the two particular systems that is important here is the spleen and the lung system. So when the lungs and the spleen systems are weakened, the immune system of our body drops, and this makes us more susceptible to external stimulus. So sinus is a multifactorial issue. There is internal and external factors, and that's the reason why sinus from the TCM perspective is persistent. So now we are going a little bit deeper into sinus and allergy. So sinus and allergy from the TCM perspective is not just an issue with the nose. In TCM, we view it in the holistic approach. So when sinus and allergies were to occur, it reflects an underlying imbalance in the body. And as mentioned previously, the imbalance would tend to occur at the lungs and the spleen. So the first system, the lungs. So why is the lung so important? From the TCM perspective, the nose is the opening of the lungs, and the lungs perform many important functions, and this involves regulating breathing, circulating the qi, and it keeps the airway open. So when the lungs were to be unable to perform its function, stuffy nose, sneezing, increased nasal discharge, and reduced sense of smell would occur. Spleen. So this is another important system. From the TCM perspective, the spleen actually helps with digestion. It helps to boost the digestive function and increase the nutrients absorption and distribution throughout our body. Another important function of the spleen is that it helps to regulate fluid metabolism. So when the spleen fails to perform its function, when fluid metabolism goes haywire, this imbalance can lead to fluid accumulation in our body, and this in TCM we call them phlegm, and this can lead to persistent sinus congestion. It can lead to increased nasal discharge. It can cause heavy sensation in the head, and it can cause chronic issues with the sinus. So from the TCM perspective, when we treat patients in the clinical setting, we have to differentiate their symptoms. Basically, the body types that they are currently in. Only then, based on these symptoms or pattern, we would prescribe treatment. So this is the first common pattern or syndrome that we see in the clinical setting. It's called the Wean-Cold syndrome. So individuals with this Wean-Cold pattern, they generally present with a lot of sneezing. They have runny nose with clear watery mucus, and it usually worsens with cold air and aircon. So this is commonly seen in acute rhinitis with histamine release. So the next common pattern is this Wean heat pattern. So such individuals generally have stuffy nose, yellow mucus, often accompanied by sore throat and headache. So such individuals generally would be suffering from, for example, bacterial infection of the sinus. So the last common pattern is this spleen T deficiency with phlegm. So individuals with such pattern, generally they have been suffering from sinus issues for quite some time. So they usually have stuffy nose, a lot of mucus secretion, and they generally will experience fatigue as well. So this one is generally seen in individuals with chronic sinusitis. Okay, so now I'll be sharing some acupressure massage that you can do at your own free time to help better manage sinus. Okay, but before we go into the points, let me just share what is the recommended way to massage the acupoints. So first, you locate the acupoints, and then you apply firm pressure onto the acupoints, and then draw them, massage them in a circular manner, clockwise and anti-clockwise. You should feel a little bit sore. You can massage these points for like 1 to 3 minutes. Okay, so the first point, from the diagram you can see, yeah, so basically it's along the edge of the index finger. So yeah, you just have to find the point, massage it. It will be helpful for nasal obstruction, and it's also helpful for issues of the head, such as headache and neck pain. Okay, another commonly used point, feng shi, is located at the back, at the base of your skull. So again, it's a helpful point for the issues of the head, which includes nasal obstruction. It also helps with headaches and fever. So the next point, yin xiang. So location-wise, it's a bit complicated. So basically, it's just at the edge of your nose. So you can massage it 1 to 3 minutes a day. So it helps it helps directly with sinus. So the next point, shang yin xiang. Again, a complicated way to find the location. Basically, it's just slightly above the previous point. So you can actually massage them together to boost the effect on the sinus management. So now, a few herbal remedies, herbal tea that you can incorporate into your diet to help with sinus management. Okay, so first is this ginger perilla tea. So basically, it comprises of perilla, fresh ginger, and red dates. So this one will be beneficial for the wean cold pattern that we were talking about previously. The peppermint chrysanthemum tea. So this one has a cooling effect, so it helps with the wean heat syndrome that we were mentioning previously. So the last one, the citrus licorice tea. So this helps with the spleen deficiency with phlegm. So this one basically helps with the digestive system, and it helps with the phlegm clearance. So now a few lifestyle and dietary adjustments, because from the TCM perspective, TCM is not just treatment, it's also a lifestyle. So in the clinical setting, we will usually recommend some dietary and lifestyle adjustments, which includes avoiding raw and cold food, avoiding cold air, avoiding sleeping with wet hair, do some regular exercise, and change out of sweaty clothes. So in summary, 2 main organ systems that we are concerned about, the lungs and the spleen. A few acupoints that we can incorporate into our massage, 合谷, 风池, yin xiang and shang yin xiang, and some herbal remedies that you can incorporate into your lifestyle. Yeah, and yeah, it'll be good to do some lifestyle adjustments as well. So thank you.
Thank you very much, Physician Lim. Now, once again, there was Physician Lim Zhitao, Senior TCM Physician, Yu Yin San TCM Clinic. Now, today, we've gained valuable insights on ear, nose, throat conditions. Now, again, well, ladies and gentlemen, you know the drill. If any questions, please do submit it here, and we'll get to them during the Q&A session later on. Last but not least, ladies and gentlemen, we have for you Dr. Jimmy Lim, ophthalmologist at Glen Eagles Hospital. Now, Dr. Jimmy Lim is a ophthalmologist and an eye surgeon practicing at Glen Eagles Hospital, Singapore. Now, he specializes in cataract surgery, refractive surgery, also known as LASIK, cornea disease treatment, and general ophthalmology. Now, prior to setting up his private practice, Dr. Lim was a senior consultant and deputy head of cornea and refractive surgery at the National Healthcare Group Eye Institute at Tan Tock Seng Hospital, providing quality eye care to both local and foreign patients for over 17 years. So, ladies and gentlemen, we're very lucky to have Dr. Jimmy Lim today. Dr. Jimmy, now we're going to hand over the stage to you.
Thank you. Thanks for having me here today. And thanks for spending the afternoon with me. Shall we begin? Yep. So today we're going to talk about see well, live well, eye health for everyone. This is my clinic. Well, here are my previous training places. I was in Texas for a moment, and taking care of sportsmen, astronauts alike, and of course in Switzerland as well, where I was doing some of my training as well. Okay. So one of the most common symptoms that I have in my clinic is that the eyes are tired and burning and tearing. And this is one of the most common diseases that I see on a daily basis, the dry eye diseases. Common diseases and the symptoms includes tired eye, stinging and burning sensation with an intermittent blurring of vision. And sometimes it's so bad that the vision can be affected, causing poor vision and constant discomfort, which is terrible. I'll show you a photo of a person with very bad dry eyes and severe irregularity on the surface of the eye. This affected a person's vision. With treatment, as you can see, the tear film becomes regular and smooth, and the vision has improved. Here's a video of a person with a very dry eyes. You can see how uncomfortable the patient is by the constant blinking the person is experiencing. And imagine someone looking at you and blinking all the time. And with treatment, you can see the blinking becomes back to normal. You hardly see the blinking in the patient's eye. So what are risk factors of dry eyes that you can help yourself with? Hydrate. Drink lots of water. Long hours on screen. I know we can't help it, but please take a break in between the screen. Adequate sleep is a little bit need to be overemphasized because this is something that we don't do very much. Environmental pollution. Medications. Some medications such as antihistamines, antidepressants, they can actually cause dry eyes, and sometimes autoimmune diseases and inflammatory diseases. There are many, many eye drops around over the counters and in doctors' offices for anti-inflammatories, dry eyes. But which one do you choose? I just want to show you that currently with technology, some positively charged tear film like this, when it drops in the eye, spreads very evenly. But normal eye drops, they tend to perch on top of the eye. So you can see that there's better spread if you choose different type of eye drops. So different eye drops actually do different things. And one of the things that I see very often in my clinic is patients coming saying that I see mosquitoes flying in my vision. I see dust particles floating about. And sometimes I'm catching and I can't find them. I think many patients actually experience this in your vision. When you look up at the clear blue sky, you see these black spots in the sky and also all these worms that's floating in your eyes. What are floaters? Actually, it's found in aging and myopic eye. Liquefaction and detachment of the vitreous gel is generally harmless, but it needs to be checked because sometimes it may be bleeding in your eyes, retina tears, and detachment. So I always advise patients to come and see the doctor. Here is a photo of how it looks like. As you can see, as the gel pulls on the retina, sometimes it causes a tear or break. And you can see that there's all these little wriggly lines in the gel that's floating around your eye. That is what you call floaters. So can it be treated? That's the most common questions patients ask me. Well, I would always tell them treatment is definitely unnecessary unless there's associated retinal tears, break, or vitreous hemorrhage. So really just monitor the symptoms, look for any worsening of symptoms such as worsening of floaters and flashes, or decreased vision. And you need to see an ophthalmologist as soon as possible. Here are some photos of retinal tears and detachment seen in patient's eye. But more often than not, floaters is quite benign. Usually they are not associated with any tears or breaks. The next thing, a lot of families come and ask me, and parents come and ask me, I have a family history of myopia. Will my child have myopia? So myopia is a condition where you can see near objects clearly and distant objects poorly. And it affects about 75% of age between 15 to 19 years old. I'm myopic myself, so it's very common in Singapore. So the myopic eye is because the eyeball is longer and the light focuses in front of the retina. That's why you need to wear spectacles to push the light back to the retina. But what are the symptoms in the child if the child is developing myopia? Persistent squinting. needing to sit closer and closer to the television, unaware of distant object, excessive bleeding, and frequent rubbing of the eye. So why do we have to prevent myopia? Just wear spectacles. What's the big deal? Well, high myopia can result in retina thinning and tears and breaks and glaucoma, as in this patient. So early cataract and inconvenience of wearing spectacles and contact lenses. Can we prevent it? Yes, we can prevent myopia by having the kid playing more often outdoors and getting exposed to the sun. Go to an optometrist, get the child checked, and give him corrective prescription if the glasses is required. The strategy to prevent myopia is to prevent the axial length from getting longer. So now we have very effective medications such as atropine to be used in children's eye to prevent the axial length from getting longer and longer. So we use laser to measure the patient's eye to see how long the eyeball is to monitor them. There are other accessories out there such as Hoya lenses. But what I don't recommend to patients is to use auto-K to correct the cornea at night when they sleep, and tomorrow morning they don't need to wear spectacles. So another one is, I have a family history of glaucoma. What is glaucoma? Glaucoma is when there's an increased pressure of the eye causing damage to the optic nerve. It's a disease of progressive damage to the optic nerve, and it's a blinding condition. It may be associated with high pressure. But what are the symptoms? Well, unfortunately, majority no symptoms. They are unaware of gradual visual loss until very late. And unfortunately, it's irreversible. As you can see in this photo, there is a progression of the glaucoma from a normal nerve to a nerve that is very big. And this is a photo of a patient with glaucoma. And what happens is the vision becomes a tunnel vision. The peripheral vision is all lost, and all they can see is the central vision, something like this. So glaucoma is usually diagnosed on a routine examination or screening. So when do we screen? We screen when you have a family history of glaucoma, age above 40, history of eye injury, or chronic use of steroids. There are many modern diagnostics that we use. These are some examples of how we check the pressure in a patient's eye. We use machines such as these to look at the fiber thickening of the retina around the optic nerve to suggest whether patients have glaucoma or not. Like in this case, there's thinning of the nerve, and we found that patient has glaucoma. This is a visual field that we do for a patient with normal visual field, and a glaucoma patient would have a visual field that looks like that with a lot of darkening around the visual field. So how do we treat glaucoma? We can use medication, we can use laser, and we can use surgery. Medications are very effective now, and hardly patients need to go for surgery nowadays. And sometimes we use laser to increase the channel of flow in the eye, and sometimes we insert small little stent in the patient's eye to allow the fluid to flow, such as this. So another one is, I have difficulties recognizing faces. One of the other common complaints I've seen in patients, I have progressive blurring of vision. To understand this, you need to understand where the lens in the normal eye is, just like the spectacles. This is a lens that's clear. There is no cataract in this patient's eye. So what is cataract? And why am I showing photos of waterfall? Because cataract derives from the word waterfall in Latin. And you can see in this case, it doesn't need a doctor to diagnose that this patient has a very dense cataract. And this person has a very dense central cataract, causing changes in the power of the eye. And an 80-year-old lady that I saw this morning also had a cataract that looks like this. It's a very dense cataract in the upper arms cataract, I call them. However, some steroid-using cataract or cataracts from inflammation and trauma, you can have a posterior subcapsular cataract that occur in patients as young as 30 years old. And this patient is about 42 years old with a history of injury. So when do we need surgery? We need surgery when your vision is affected, your daily life is affected. You can't see the bus number, have difficulty crossing the road, and any of these other activities that you love to do and can't do because of poor vision. In ancient history, the Egyptians just used a needle and poke right through the person's eye and drop the lens to the back. However, it doesn't solve the problem, because currently what we can do is we insert lens to give you spectacles-free vision. There are many types of refractive error. We can correct for myopia, hyperopia, astigmatism, and even presbyopia. So what has it got to do with this aeroplane, the Spitfire in World War One? Because of the Spitfire during World War One, the acrylic that entered the patient's eye is found to be inert in the person's eye. And it was discovered by Sir Harold Ridley, and he invented the first intraocular lens. So intraocular lens is a big deal, and it helps us correct for vision for far and intermediate, known as monofocal lenses, astigmatic lenses that correct astigmatism at the same time, presbyopic lenses, trifocal lenses, such as EDOF lenses, such as this person. You can see that without the reading abilities, it's going to be on the right. With the reading ability, you can still see the menu on the left with EDOF lenses. And there are also multifocal lenses that are in use currently as well. The difference between is about the halos and the glare. Multifocality allows you to read better than EDOF lenses, but EDOF lenses have less halos and glares. Such as this, when you're driving, you can see the distance, you can see the intermediate, and you can also read your phone at the same time, though it's not recommended. How you choose the lens power? Well, it's an art and a science. It's a little bit like customized vision correction, where we measure in the tailor shop, how do we put inside the person's eye and the power. We have a whole suite inside the clinic just to measure patients' vision. And it's customized measurement of the eye using machines to check for how steep the cornea is, how deep the lens is, and how long the eyeball is. This is what we do. We also use topographic map to look at the cornea surface, to look at how steep the cornea is and how much astigmatism that we need to correct for the patient, such as this. So the cataract surgery is undergoing phacoemulsification. It's very fast. We do a surgery in about 15 to 20 minutes, and many patients have benefited from cataract surgery. So choose a well-experienced and a well-trained surgeon for your cataract surgery. And you have a good outcome if the cataract surgery is done smoothly. Such is a multifocal lens in the patient's eye. A multifocal lens allows you to see for far, intermediate, and near at the same time, and this patient has astigmatic correction at the same time. And this is a monofocal lens allowing patients to see far and intermediate. And to summarize, the take-home message today for you is, your eyes are vital to your well-being. Some symptoms, though trivial, may look serious problems. There are rapid advances in the technology in eye and ophthalmology, and most parts, prevention is better than cure. So do consider regular eye screening. You can visit our blog for more information. And with that, I thank you for your time today. Thank you.
Oh, thank you very much, Dr. Jimmy Lim. Oh, that was super interesting and very informative. Thank you very much, Dr. Jimmy. All right, now, ladies and gentlemen, thank you very much for joining us. Now, at this moment in time, we're about to reach the Q&A segment. For those of you who have questions, please do continue to send them in. We'll be starting the Q&A in just a bit. Before that, let me bring your attention to something else. Now, for those of you who may have seen this before, I'd like to bring you the My Health 360 app. I'll take a look on screen now. This is an amazing app, super useful. It is a one-stop mobile app designed for you to manage all aspects of your health and wellness. And what do I mean by that? I'll take a look. Now, with the My Health 360, taking charge of your health is really easy. You can take a look at all these lovely things that you can do. You can teleconsult a Parkway Shenton doctor on demand via appointment. You can book your e-appointments, retrieve your EMZs, find specialists, treatments, get access to symptom checker, and a whole list of benefits are all there. Get a bill estimate and more. Now, question, how do you get this My Health 360 app? Now, all you have to do is to scan the QR code you're about to see on this slide. All right, so I'm going to give you a few moments to scan the QR code if you're interested in having the app, the My Health 360, your healthcare companion for healthful life. All right, so next few seconds for you to scan this code, and we'll be very, very excited to show you our promotion. Let's take a look at the next slide. Ladies and gentlemen, this is the Yu Yan San promo slide. Now, for today, take a look. Now, Yu Yan San has extended a preferred rate for the webinar attendees, which are all of you here today. What this goes is that we have for you a TCM consultation and an acupuncture bundle at only $58 net for the first-time patients. Or you can choose a $0 TCM consultation with any medication done, medication taken, and treatment done. So now all you have to do is to show the webinar EDM screenshot to redeem. Now, please do scan the QR code to find out more. I'm going to scan this myself as well. It's pretty awesome. All right, so please do scan this. Ladies and gentlemen, of course, at the same time, as you are scanning that, we'd like to quickly make our way to the next segment. And this segment, we're going to have all three gentlemen, our doctors, our practitioners, who's all seated here. So ladies and gentlemen, this is where we'll address all your questions. Let's take a look. Welcome back, speakers. Here we go. Thank you very much. So speakers, hi guys, thank you very much for joining us. We learned so much. All of us here in the studio, we're listening to you. So now I'll be addressing some of the questions which came in from the audience. All right, we're going to go one by one. We're going to address the question to each of you. So feel free, to answer it in your more comfortable fashion. All right, now first question goes to Dr. Chen. Now, sir, we believe that there may be some side effects. Are there any side effects of prolonged use of nasal sprays now, and when to consider seeking specialist advice for that?
Okay, so there are actually 3 types of nasal sprays. So we got to define which one we're talking about. Just now I covered nasal saline sprays. Absolutely no side effects unless you discomfort from shooting it wrongly. Nasal steroid sprays, I covered that as well. And as far as we can see from studies, there is no long-term side effect. Now, it's one caveat. It does cause drying of the nasal mucosa because you get less. So if you have a very deviated septum and you don't spray it and it sort of gets deposited there, it's going to cause more drying there. So if a patient already has a problem with dry mucus, bleeding, that may get worse. And that's the only situation. And the last kind of nasal spray are the decongestants. These are the ones you can buy off the counter, and they are very effective at blocking your nose. I use them sometimes. These are not meant to be used long-term. There is a condition where people love that so much, works so well, that the body becomes conditioned to having it. And the moment you don't use it, everything just goes haywire. It's like taking a drug and then becoming addicted to it. So those are decongestants. We say that use that for your flus, for your short-term sinusitis, to get some relief, not to be used long-term.
Now, so at which point do we consider seeking specialist advice?
So this is a very broad question. I think if we're using sprays, then we're thinking about dealing with allergies. So I think one situation, if you're using nasal sprays and they're not working at all, nose is still blocked, that's a situation. If you're using nasal sprays, they were working for a while and they're not working anymore, that's a situation. And the other situation, which all doctors will say, when your symptoms start to change, let's say it starts to become discolored, you get blood, you can't smell so well, and there could be some other diagnosis that on top of the allergy that the patient has had before.
Right. Thank you so much for your lovely answer. Now, next question is for Physician Lim. Now, sir, how would I know when taking TCM medicine or treatment, which takes a long time? How do I know if I'm taking too long? When should I continue? When should I stop? Is there a guideline on that?
So TCM, it mainly targets the imbalances in the body. So there's a few diagnoses that we go as to when do we start to stop or start to reduce the medication. So first is on a clinical setting, we look at their tongue and their pulse. If it is the ideal tongue and pulse, then we can start to reduce the TCM medication. So another diagnostic requirement would be that for the next 1 month, there will be no flare up in their sinus, and they are able to, for example, stand in an aircon room for 20 minutes. They are able to eat stuff like pizza and cold drinks without their sinus flaring up. So all these will be a good indication that it will be a good time to start to reduce their TCM medication.
I see. Thank you very much, physician. All right, Dr. Jimmy, thank you very much. Now, in your presentation, you talked about floaters, and there's this viral TikTok video that came about recently saying you see floaters, and something is really wrong, it's really serious. So we're glad that you managed to to talk about it. Now, the question is, how do you manage eye floaters and flashes? Or family members with any glaucoma history?
Okay, let's just tackle first part of the question, floaters and flashes. Now, floaters and flashes are very common in patients' eye, and I have floaters myself. Now, floaters that you see on a daily basis and the numbers are always about the same, those are regular floaters that is because of degeneration of the vitreous gel. Now, those floaters that are more sinister, they tend to have a lot, hundreds and thousands of floaters suddenly coming out of nowhere, something blocking your vision, constant flashes of light, and that's when the vitreous gel is pulling on the nerve and there may be a damage to the nerve. So in those situations, you need to see an eye specialist as soon as possible. Can you really manage floaters and flashes? The answer is probably not. You probably get used to it. Like if I look at you now, If I pay attention, I can see a couple of flutters in my eye, but if I ignore it, it just kind of goes away. Now, the second question goes to, if a family member has a glaucoma history, so it's very important when someone has a family history of glaucoma to get themselves checked. Well, I guess it's also dependent on how young or how old the person has glaucoma in the family members. The younger the family members have glaucoma, I think the earlier the person should go for a check. I mean, in general, we advise people above 40 to go for a glaucoma check. But if you do have a very strong family history, everybody in their family has, and someone is blinded by glaucoma in the family, please go and see an eye specialist as soon as possible because it's really no symptoms at all.
Well, there you go. It's a good reminder for us. A lot of us, we go for health checks for other stuff, but glaucoma checks above 40, if there are some relevant symptoms, go for a check. Why not, right? All right, now, Dr. Chen, this is a very popular question, I think, because a lot of us have sinus, but how do you resolve chronic sinus problems in children and teenagers? It's a...
I think this question brings up the difficulty we have when patients describe sinus. So I'm guessing that a chronic sinus problem in a child and teenager is most likely going to be allergic rhinitis. So as we talked about it, actually the only way to finally resolve it, some people are lucky they grow out of it, meaning their immune system becomes better regulated for whatever reason. But otherwise, immunotherapy for children, teenagers, I think that's the way to go because they have such a number of tens of years where they might still be suffering from it. And at that age, if we can cure it, we probably have an 80 to 90% chance of curing with immunotherapy. That might be a good way to treat it and give them a head start for the future. For very small children, like primary school age, sometimes this sinus problem could be recurrent upper respiratory infections. And if they have a big adenoid, you can imagine that chunk of tissue there that gets inflamed. It takes so long to settle down each time. Besides the usual medical treatments and sprays, sometimes they may be better off having that adenoids taken out surgically.
I see. So consult your specialist to find out more. All right. So, okay, now next question, Physician Lim. How can TCM address issues with the deviated septum? It's two different worlds.
So unfortunately, TCM would not be able to correct the structural defect. But what TCM can help is with the secondary consequences like the post-nasal drip, the inflammation, the congestion. So that is where the TCM will shine, so as to say.
All right, thank you very much. There you go. All right, now next question. Dr. Jimmy, how do you protect eye health or individuals who work on laptops and stare at monitors day in and day out?
Yes.
I see. I have an answer for that. So don't stare so long.
Yeah, so you're the doctor already. But, well, it's true. I mean, most of us look at these laptops, and me included, all the time, or look into microscopes, and we use our eyes all the time. The first thing we do when you wake up in the morning, we use our eye. Well, I think the simple thing to remember is 20-20-20, right? Doing something for about an hour or two, take a 20-minute eye break. Stare at something 20 feet away, and just and maybe just every 20 seconds or so, just blink, relax your eyes, and just make sure you're comfortable. There's no real way of protecting your eye health for individuals working on laptops or stare at monitors, because that's what we do with our. It's a function of the organ. But if your eyes are feeling dry, if the eyes are telling you that I'm not comfortable, put some tear drops, put some eye drops. If you're finding that you've been blurring your vision and you're blinking a lot and you're rubbing your eyes a lot, just get it checked to see if there's any allergies or so.
That's very interesting. Now, Dr. Jimmy, you talk about 20-20-20. Can you just bring us through it very quick? What's the SOP for 20-20-20? Every 20 seconds, is it?
Yeah, I would like to say that, try and blink.
Blink, okay.
Blinking is important. Take a 20-minute eye break. Stare about 20 feet away, and then you feel a lot more comfortable after that. Don't just keep going through the day on a laptop,
Yeah, some of my friends here in the studio have been looking at the laptops for more than 1 hour now. Guys, can you take 20 feet away right now, please? Guys, step away. 20 feet. All right, now, guys, next question. Let's take a look. Okay, now, Dr. Chen, how do I know if I'm having sinus or having a flu? That's part one. Part two, I tend to have bad sinus on a monthly basis. How do I resolve that? Now, first question, sinus or flu?
I think, again, the sinus in this case, look at your daily pattern. If it's the same thing, it's a runny nose, sneezing a bit, and then 3 hours later you're better, that's your normal pattern. So that's what sinus, but I call allergy, right? Allergic rhinitis. If you're having a flu, and we've all been through this, you feel sick, something is different. You feel tired, there's a bit of a sore throat, and you think that, okay, I'm sneezing a lot more now, but later in the afternoon, at the night, it still doesn't get right. So it's either a very bad bout of allergy or you've got flu. More likely it's got to be flu. I think that's, yep. Second one, bad sinus on a monthly basis. Monthly basis, I'm suspecting this person actually is talking about getting recurrent upper respiratory infections. And how do we resolve that? I think you need to see a specialist to check. Sometimes we need to look at whether the underlying conditions like allergies are not being well controlled. Is there a need to check on the immune system? I think, and sometimes just to make the diagnosis, because some patients might just be getting bad bouts of allergy every month, they think, and mixed in with infections, it's sometimes a bit hard to tell. You've got to see the doctor when it's happening to try to figure it out.
There you go. And everyone has a different body. We need to have the specialist to look at you to have a customized plan for you. All right, so next question, Physician Lim. Can TCM totally cure sinus?
So so the definition of cure from the TCM and Western perspective will be a bit different. So if we take the previous question, deviated septum. So from the Western perspective, the cure will be like the septum is entirely straight. Yeah, but from the TCM perspective, it's technically cured if the symptoms doesn't flare up. Yeah, so, and the way we go about it is to adjust the body and hopefully get the body to self-regulate better. Yeah.
I hear you. Thank you very much, sir. Dr. Jimmy, to you now. What are the preventive measures for glaucoma?
No, I don't think there's really a preventive measure for glaucoma. You really cannot prevent glaucoma from happening to yourself, me included. Now, what could be secondary glaucoma that you can prevent? Yes, eye injuries. You have eye inflammations that's chronic. Those are the glaucoma that you can prevent, because they have a reason for it, like chronic use of steroids. Those are preventable. But majority of glaucoma per se is, kind of predestined by your genetics. Right. So you really cannot prevent glaucoma per se. So you really have to get it monitored or checked, rather than say, I would like to prevent it by doing some sort of exercises in the morning.
Got it, doctor. Thank you. All right, now, Dr. Chen, how do you speed up recovery of sinusitis?
Okay, listen, I've gone through this many times, so I've got the perfect recipe for it. Okay, when you first detect it, you got to prevent the buildup of the mucus and the clogging. So that's when you use the decongestants. Everyone knows this already. One other big secret, and I tell 10 people, if even one person takes it up, that's of value. Because the nasal saline irrigation, it clears those clog points and it helps to improve the recovery time. But what Physician Lim said as well, if a patient feels better, and you know that you're just washing it, it's going to have effect for a couple of hours and then it builds up again. But those few hours feel different. And I think that cumulatively helps. I'm not going to talk about antibiotics because that's already done. So I think these are the two big tips that I would have. I do it personally and it works.
Right, there you go. That's very good advice. Now, Physician Lim, to you now. Is sinus linked to heatiness or body constitution?
So actually they're related because the body constitution or the body pattern, they include heatiness. So in the slides just now, there's like the wind heat, there's the wind cold. So all these are just reflections that the body, there is some imbalance in the body. And in some individuals, that imbalance might manifest itself as heatiness. So the bottom line is, rather than looking at heatiness per se, we, as TCM physicians, we focus on the body constitution, the pattern, whichever they might be, and then seek to correct this imbalance.
I see. Interesting. Thank you very much. Dr. Jimmy, interesting question here as well. Now, what simple massage techniques are suitable for elderly experiencing eye symptoms such as watery eyes, irritation?
Well, there's neither simple nor complex massage techniques that are suitable for the eye, to be honest with you. Most people just rub their eye because they are uncomfortable.
Like this?
Really just because they are, reacting to the symptom. Don't do that.
Don't do that.
Don't rub your eye. Don't massage your eye, because there's really no such technique. Now, for elderly experiencing eye symptoms such as watery eye or irritation, there may be something else. Maybe chronic dry eyes, inflammatory dry eyes, or there may be a tear in the cornea. So there are many diagnoses for watery and irritation of the eye, but having a massage technique is not the answer to that.
There you go. Once and for all, right? There's no massage techniques for that. Okay, cool. Dr. Chin, some ENT concluded sinus issues are associated with food allergies. Some food allergies may bring out ENT symptoms. So how do you enjoy favorite food whilst preventing sinus outbreaks?
Okay, this is quite a tough topic to talk about because the evidence for food allergies related to sinus issues is there's not a lot of it compared to our other studies. But to me, this doesn't mean that it doesn't exist because there's so many people that we see where they can see a pattern with what they're eating and what symptoms they get. So I tend to look at a more TCM holistic way when I'm talking to these patients. I do all the necessary things to rule out the obvious things that they have. If they don't have it, the tests are negative, and they have a pattern of food association of symptoms, then we try to explore that. And we assume, yes, there's something going on in the body. There's some inflammatory allergy thing going on. The nose or the skin or whatever part of the body is a manifestation of it and spilling out. So that's a sign. And the simplest thing is don't overeat those foods. If you really need to have it, and if the main symptom is a runny nose, then just take an antihistamine preemptively, spray the nose preemptively, and then enjoy the thing and minimize the side effects. That's my advice.
There you go. There you go. Thank you very much, sir. Okay, now let's make our way to the next question. Physician Lim, now how can TCM help improve my sleep, especially since I wake up with sinus issues every morning?
So from
TCM perspective.
So from the TCM perspective, sinus issues, poor quality sleep, all this boils down to the root, the core issue, which is the underlying imbalances in the body. So in TCM, we don't just focus on like the symptoms per se. We try to go down to the root of the issue. So there are many symptoms. There are many underlying imbalances that can affect this, from a weakened spleen. All these are all potential imbalances in the body, and when corrected, the resulting symptoms will then resolve.
Right, thank you very much. Thank you, Physician Lim. All right, Dr. Jimmy, how do we reduce eye floaters? How do you manage eye floaters with short-sightedness and long-sightedness at the same time?
Okay, so well, I'll help them rephrase this question. How do you reduce eye floaters? Eye floaters cannot be reduced. It's something that you are already found inside the vitreous gel of your eye. It's not something that you can do take some medication. Some people touted the fact that lasers can reduce the number of floaters. I usually do not recommend lasers for such things. They're not known to be very effective. Floaters are something that's found in your eye. It's an entoptic phenomenon, but you actually get used to it in your eye, and your brain will tell you that ignore it, it's just noise. I'd like to rephrase the second question. How do you manage floaters with short-sightedness and long-sightedness at the same time? Because they are quite different things. Floaters are, of course, associated with short-sightedness and presbyopia. They're not causative of it. They are not the cause of your short-sightedness or your long-sightedness. The long-sightedness is something of age. Short-sightedness is something that you grow up with. And floaters is something that is found in your gel that is degenerate as you age, regardless of the fact whether you have old-sightedness or long-sightedness. To manage eye floaters is what I've said, that you have to monitor the symptoms. If you have more floaters and more than usual, or vision becomes worsening, please see an eye specialist. For short-sightedness and long-sightedness management, if there's another question, we'll answer that later.
There you go, different schools altogether. Thank you very much, sir. Thank you. All right, now, Dr. Chin, in what situation does a plastic surgeon needs to work with an ENT doctor on sinus surgery? For example, my ENT doctor did septoplasty on my nose after my sinus surgery. It's a very specific question.
Okay, so we have to think about the anatomy, so it structures then. Sinus surgery does not involve a plastic surgeon at all. A septoplasty, which is the first operation I was covering, where it's all internal, actually does not need and should not involve a plastic surgeon at all. When you're dealing with a nose that's very crooked, and it can be seen generally on the front or the basal view, and that requires some sort of adjustment and grafting, sometimes it can be of value to work with a plastic surgeon. The thing is that we need to look at it at the anatomy. When we do an open septorhinoplasty for a functional reason, a blocked nose, everything is open there, and the best time to do anything that you want to do is at that point, so we can make it straighter. And by making the nose straighter, actually the tip may look in a better position, the nose is straighter, there's more symmetry. But sometimes patients say, at the same time, I want my nose bridge to be higher. Can you do that? And that is the perfect time to ask the question. It doesn't mean you need a plastic surgeon to do that. The surgeon that as Dr. Jimmy was saying, as long as the surgeon can do what you want him to do, that is good enough. But there are complications in any system. If you are involving cosmetic portions of the operation, then insurance won't cover that. So And those are all things that you need to discuss with surgeon. Yeah.
Thank you very much, sir. Thank you. All right, now, Physician Lim, besides acupoint massage, what herbs can I take to drink to relieve my sinus?
So previously covered in the slides, there are some teas that we can incorporate it, but of course, whether those teas are suitable for you, it depends on the pattern. So if unsure about the pattern, it will be best to consult the physician. Yeah.
Because everyone's constitution is different.
Yes.
Got it, sir. Okay. Dr. Jimmy, preventing presbyopia and constant twitching in eyes. What's going on?
Okay, let's answer the first part, which is preventing presbyopia. I always say in jest, I always joke with my patients, how do you prevent presbyopia? Just don't blow your birthday cake, that's all. Don't age. That's the reason that you have presbyopia. Everybody has to age gracefully. There's no way that anybody can prevent presbyopia. Can we treat presbyopia with the different type of lenses that we have? The answer is yes, but presbyopia is a factor of time. It's not a disease, it's not pathological, it's just how you grow. All right, so there's no prevention, but yes, it can be managed subsequently when we change the lens. Constant twitching in the eye is a different thing from presbyopia. Constant twitching in the eye is when I think most people will experience some sort of twitch in the eye. Those are very common. This shows a sign of fatigue. Most of the time, the muscles around the eye are very tiny and small. It's like you go to the gym and you carry very heavy weight and your muscles start twitching. That's exactly what's happening to the eye. Usually found in patients with uncorrected vision and they are squinting all the time. Patients with a recent viral disease or some sort of inflammation of the nerve. Patients who have too much caffeine, late nights, not enough sleep, chronic fatigue syndrome. These are the most common causes of twitching in the eye, and that's what's going on. But when would I be worried about twitching in the eye? Twitching in the eye just goes away with time. Some cold compress, make yourself more comfortable, and you'll go away. You worry about twitching in the eye when it spreads to the rest of the face. When your face starts twitching and your lip starts twitching, we are worried that the nerve is being compressed by something. So when that starts moving or progressing, yes, please go and see a specialist as soon as possible.
I see. So it's nothing to do with someone thinking of you. Because, when it's twitching, someone's thinking of
That
you.
as well.
That as well. That's mostly it, right?
Yes.
Mostly. Right now, Dr. Chen, for the last 2 to 3 years, I've been having sneezing and runny nose in the morning, which lasts mostly 15 minutes to half an hour. And sometimes longer, mostly after taking showers. So after shower, he has it as well. So if I don't sleep in the aircon room, then it doesn't appear. The issue started about 2 years back and it keeps coming back. So what this person is saying is that probably the aircon is contributing to her having sneezing and runny nose. What's your thoughts on it?
Okay, so actually, our first measure in allergic rhinitis is avoidance. So if we just said, don't sleep in aircon and don't take showers, but that is absolutely not going to work. So that's why the question is being asked. So we don't know the age of this patient, but there are also non-allergic types of rhinitis. So a patient can have both. The usual story for 15 minutes and all that maybe sounds like allergy. But then we think about it. Once your whole system is set up to be reactive, any other trigger will have a bigger reaction, right? So you have dry wood, you throw a match, it's going to burn. If you've got moist wood, nothing's going to happen. So I think that's what's going on here. And if we want to target, okay, we don't know if this patient is taking medications. You could start with antihistamines. You could try to treat all that as we talked about earlier. But if that doesn't work, then what do? Look at the environment, anything we can change? Not really. Perhaps if it's just runny nose and sneezing, we talked about cryotherapy. We don't know the cause, but we can disable the output side of that equation. Maybe that will be something to consider. But of course, this needs to be looked into more detail.
There you go. That's a great answer, by the way. So thank you very much, Dr. Chen. All right, now next, Physician Lim. How can you help with sinuses at the clinic? I think we covered that before previously, huh?
So at the clinic, when we target sinus, after identifying the underlying imbalance, usually the two main modalities would be herbal formula and followed by acupuncture.
There you go, herbal formula and acupuncture. Thank you very much. Dr. Jimmy, I've been using eye drops daily for my dry eyes. Now, does lutein supplements help with this condition? If not, any recommendations?
Yeah, so if you're using eye drops daily for your dry eyes and it's you're managing poorly, it means your eye drops frequency is very high, I suggest you see a specialist. But if you're managing well, occasionally you're using the eye drops, that's perfectly fine. Now, lutein supplements are actually the building blocks of the retina. They're actually used for age-related macular degeneration or retinal degeneration diseases. So lutein supplements do not counteract with the conditions of dry eyes. Sometimes in dry eyes, we recommend omega-3, high concentration. That really treats the inflammation of the eyelid margins so as to improve the tear film quality. So if any supplements for dry eyes, usually it's omega more than lutein.
I see.
Yeah.
I see. All right, so definitely not lutein. All right, now, Dr. Chen, my apartment is next to Bukit Gombak Forest. This is the property agent question. Yeah, my apartment is next to Bukit Gombak Forest. So is it due to pollen? Earlier I was... Okay, so I think he or she is having some allergic reactions after staying next to Bukit Gombak Forest. So is it due to pollen? Because earlier she was staying elsewhere and she didn't get it.
That's a possibility. It's not so common in Singapore. And it usually takes about 3 to 5 years to develop an allergy, actually. So I think this situation requires testing, and maybe there may be some other factors about this. It's not impossible.
Yeah. Testing is the way to go from here. Yeah, awesome. All right, so Physician Lim, is herbal medicine or acupuncture more effective for treating sinus issues?
So in the clinical setting, usually it's a combination. So herbal medicine is more to help with the inner imbalances in the body. So acupuncture is more for symptomatic relief. If the congestion, if the pain is severe, then usually we'll do acupuncture to bring about faster relief, and then for long term using herbal medicine to adjust the body.
There you go. Thank you very much for that. Dr. Jimmy, how can we manage and relieve tired eyes? Products or tools that can help, like heated eye masks, is there any recommended frequency and do they work?
Yeah, so to relieve tired eyes, I would say that tired eyes usually is due to dry eyes. Long-term use of your vision, using laptops, you find your eyes to be very dry. And more often than not, is the fact that there's a lot of evaporative losses. That means the tear film does not stay on your eye for a long time and evaporate very, very fast. Yes, using heated mask, sometimes we use heated mask to treat the lid margin, but there's not actually a recommended frequency for that. I'm not so much a doctor that recommends too much gadgets for my patients. I usually like to diagnose them and see what is actually the cause of it. Even though it's dry eyes, it could be many reasons. It could be lid margin issues, it could be evaporative loss issue, it could be production of the tear film issue. So I would say for symptomatic relief, yes, you may use a heated eye mask, but I think it's also good to look at the root cause of the problem to get this sorted out. Yeah.
Is there such thing as too much eye drops though?
Yes, there is actually. So some eye drops actually contains a lot of preservatives, a lot of over-the-counter. A lot of my patients love to go to Japan and come back with crystal-like bottles and say, oh, I got this really nice bottle of eye drops. They love it because it's so beautiful. But it contains so much preservatives that as you put in your eye, the preservatives itself is toxic to the surface of the eye.
It's bad.
Yeah, so they come with other eye problems. Why are my eyes red after a while? Yeah, of course, because of the toxicity from the preservative. So most of the products that I use either have very mild preservatives or no preservatives at all. And in those eye drops, yes, you can use it at a higher frequency, more than 4 or 5 times a day. Yes, but with the preservative, yeah, once a day maybe. Yeah.
I see. That's good advice. Thank you, sir. Thank you. All right, now with 5 more minutes for the rest of the questions. Now, Dr. Chen, may I know if it's fine? Is it fine for children under 5 to be on puffs like the Flixotide or Ventolin for hypersensitive respiratory tracts?
Very good question. Before I answer, just caveat is that this is probably asthma or reactive lower airways. As an ENT, we don't primarily deal with that, but they are associated with allergies as well. So broadly speaking, from working with our pediatric colleagues, if the child is getting asthma or recurrent bronchitis, those symptoms are obviously more severe than the potential long-term side effects that one might consider. But this kind of situation needs to be worked out because it is true that high-dose inhaled steroids, not nasal steroids, can actually affect the balance that I talked about in very, very high doses. And those things can have some effects. But then in those situations, the question is what's worse? Suffering severe asthma that could be very, very bad or these other long-term side effects. So that would be my answer to this question. And again, looking from what Dr. Jamie said and Physician Lim as well, if there's a possible way of finding an underlying reason for the person getting these symptoms, then I think that treatment should be targeted towards that eventually.
Thank you very much, sir. All right, now, Physician Lim, or rather, Dr. Jimmy, what treatments are available for severe digital eye strain? Now, we've been receiving a lot of questions like this for you today.
Yeah.
Right? I believe this is a common problem that
Yes,
all
it
of us
is.
have.
Yes.
So, what treatments are available? Not able to look at
Yeah.
digital screens. Yeah.
So this is real. I mean, there are people who actually come and see me that they aren't able to use their laptops anymore and digital laptops anymore. It's real, and patients come in with eye patches, wearing caps and everything for the past 1 year. And those patients have very severe eye inflammatory conditions, which they mimic dry eyes. So if you have such severity, I don't think it's something that you would want to self-treat. You know, you really should see a specialist to see if there's an inflammatory component to it, or is it a poor tear film component to it. There are a lot of things that we can do now with anti-inflammatories for the eyes and a tear film replacement. So there's a lot of things that we can do, but this sounds more severe than a curbside consult.
Yeah. Go for a professional, please, right? Professional consultation. All right, now, Dr. Chen, I'm sensitive to steroids. Not sure if going through surgery would be an option for me. It's rather general. How do you make of this?
Unfortunately, I can't really answer the question because the steroids, I'm not sure if it's a spray steroid or oral steroids, and the kinds of surgery could be related to acute, chronic, or nasal polyps, or even allergies. So it's a bit hard to answer this
I
question.
apologize, but I wish your questions can be more specific for us. But thank you very much. Moving along. Now, Dr. Jimmy, causes of dry eyes are more intense under indoor aircon conditions. And are there any kind of food you recommend for improvements to help dry eyes or in intense aircon
Right.
conditions?
So in air condition, like PSLE questions, my kid is taking PSLE because the environment has low humidity. So evaporation takes place very fast, and then the wind, the breeze, and evaporate takes place very fast. That's the reason why you probably have dry eyes in a very intense wind condition or a colder, dry condition. Food that you recommend for improvements, I think it's just water. Hydrate. Please hydrate, sleep well, hydrate, exercise, take some vegetables and fruits. I think that's a simple things that we could do for ourselves.
Very good advice. No magic potion. Back to the basics. Water, sleep, good health. It's amazing. Thank you, sir. Dr. Chen, is it common for a child to suddenly develop allergic rhinitis at age 10? Did I pronounce it correct?
Yes, allergic rhinitis.
Yeah, rhinitis.
I think it's entirely possible, and sometimes the suddenly relates to an acute infection that doesn't seem to go away. So it's brought out something that was already surfacing, and by the time they come to see us as specialists, usually it's something that's dramatic, because our GP colleagues actually treat the vast majority of allergic rhinitis very well. Yeah.
There you go. So yes, it is common. All right, Dr. Jimmy, can you explain what are the causes of left eye CSR? And how does it occur, or will it recur?
Okay, CSR is like what they call choroidal retinopathy, serous retinopathy. So it's a very long name for a bleb that form underneath the macula of the eye. These patients tend to have a type A personality, a stressful lifestyle, and maybe even on exogenous sources of steroids. So those are the possible causes of CSR, but not all-encompassing. Will it recur? The short answer to that is yes. It may recur. So see a specialist for that as well.
See a specialist, there you go. All right, now, ladies and gentlemen, that's all the time we have for today. And of course, we thank you very much for your questions. We are sorry we can't get to all your questions. You guys have been very enthusiastic. Every segment, there are a lot of questions, so we really thank you very much. Most importantly, we greatly appreciate you spending your lunch time with us, and we hope you found this webinar useful. Now, once again, heartfelt thank you to Dr. Chen, Physician Lim, and Dr. Lim for taking the time, for sharing such valuable insights with all of us. We definitely learned a lot on how to stay healthy today while protecting it tomorrow. Now, before you go, for those of you here, ladies and gentlemen, it's going to mean the world to us if you can help us share your feedback. All right, take a look at today's QR code, and if you can tell us more about today's webinar, help us improve so we can be a better you tomorrow for you. So if you can share with us what topics you'll be interested in the future, all right, so we can keep a lookout for future invites. Do share your thoughts on what interests you, all right, so we can bring those doctors or professionals to the webinar for you. Now, the first 20 participants, now this is interesting, the first 20 of you to share your feedback will receive a $10 Grab transport voucher, all right, and I think it's really going to help because, oil costs are high now. All right, so please do share your feedback. The first 20 of you is going to get that Grab voucher. So let's take a look at the QR code right now. I'm going to give you some time to scan the QR code, share your feedback. First 20 of you walks away with a $10 Grab voucher. And then, yeah. Final 10 seconds to go, and it's been a great time with all of you. This is the first webinar. We're expecting a few more to go this year. We hope you can join us for the rest as well. Remember to tell us what you're interested in so we can bring the relevant people to you. All right, now, ladies and gentlemen, again, we'd like to share with you on what our friends from Yu Sun has for you. Let's take a look. All right, again, we've covered this before. I'd like to share it again. We have for you the TCM consultation and the acupuncture bundle for $58 only for first-time patients. And of course, or a $0 TCM consultation again for first-time patients. All you have to do is just share your webinar EDM screenshot to redeem that. And again, if you'd like to have more information, do scan the QR code to find out more. Before we wrap up, very, very importantly, we're excited to share with you an upcoming public forum that's called Lessons for Life. Cancer Care Conversations. Now, this is jointly organized by Mount Elizabeth Hospitals and Parkway Cancer Center in Singapore. It's just a one-day forum. It's happening on next Saturday, 18 April at Pan Pacific, Singapore. The program will bring together medical expertise and real-world perspectives, empowering individuals with knowledge whilst highlighting the importance of multidisciplinary patient-centered care. You will also hear from patient advocates and caregivers sharing their journeys alongside insurance professionals who will provide guidance on navigating the financial aspects of cancer care, which can be very tricky. All right, tickets are only priced at $10 with proceeds supporting the Singapore Cancer Society. You can look forward to lunch, on-site mammography, interactive activities, goodie bags, and much more. All right, now please do scan the QR code to find out more. It's happening Saturday. Ladies and gentlemen, and now back to my friends here, the professionals. We thank you very much for your time. We'll be flashing the details of our speakers on screen in just a bit. This webinar is proudly brought to you by iXchange, your trusted TPA and medical services provider. Please do email us if you'd like to have further inquiries on today's webinar. We hope everyone stays safe, healthy, and happy. So thank you very much, guys. See you soon. Bye-bye. See ya.